Well, everyone, welcome to the Infection Control Exchange. This is going to be part 4 of a series of looking at healthcare construction and infection prevention and control. So we've got the 3 parts already posted on the platforms, and we're going to wrap this up with part 4, like I mentioned in the previous episode, that I thought we needed one more episode to kind of wrap up the series. So can take a look at the post-occupancy component. Sometimes we feel like once we've moved into the facility that everything is going to be perfect and there's not going to be any issues, but it's quite far from the truth. You're going to have plenty of issues to deal with for many months. Let's say at least 6 months post-occupancy. That's what you kind of look at, where you're going to start working through all those issues that are going to come up, and you're going to have a list of them that you're going to have to work on to resolve. So it's going to be, you're going to have might as well create a list once you get occupancy. But that's once you've moved in there, that's when you're going to start seeing some of the things pop up. Like I said, and you're going to create a list with how to resolve those. So, but there is an assumption, like once you move in, everything's gonna be perfect, even though it's going through a number of inspections, including with public health, and then there won't be anything. But let's focus on from an infection prevention and control perspective, and some of the things that you're going to be working on over, let's say, that's within that 6 months window post occupancy within your either within a new building or, let's say, even within a major renovation or expansion to a healthcare study. There could be a number of things. The one thing that, and I've seen this before, is the airflow or HVAC system. There's been always seen issues where that's been incorrectly set up, so the airflow is not actually working the way it should. So sometimes those things don't get sometimes those systems don't get turned on, and you don't pick up on the issues till weeks and months later. So that's another thing to look at for within the healthcare. Make sure that the airflow and the HVAC system is working the way it should be for the various zones within the healthcare system, which would include like negative pressure and positive pressure within an acute care setting. Make sure that's working the way it should be, and you're getting the required number of air exchanges and everything. So, going to be touching on certain things from some of the other episodes a little bit, but most this is focused on post occupancy and what can still go wrong once you've got moved into a new space. So, and there could be another example is some of the analyzing stations. You're gonna find some of those that got installed. Even though you did your checks, you're gonna find some of those were not installed where they should be. And you might need to move some of those hygiene stations. You don't need them. You don't need them like in an office space, wall mounted. So for any of your offices, for your leadership team, they can just have a portable hand sanitizer pump on their desks. They don't need the wall mounted units. So you can, and then for the thing for some of your nursing station areas, you might have one, or your comm areas. You might have one that's wall mounted nearby, but for the most part, you're going to have some of those just being the hand sanitizer pump. So you're going to be, you're going to be doing your walkthroughs of all the floors, whether it's the expansion segment or the full new building. And you're going to be looking around for things that need to be resolved. Some of them are going to be very simple, where you're going to be distributing and having those hand sanitizer dispensers, some that got missed. And some of them are going to just be where you're going to put the hand sanitizer pumps, where you're going to have some disinfectant wipes. So those type of things, you're going to look and see. Those things are pretty easy to do, and the maintenance team can take care of installing any new dispensers that you might need to put up for the workflow and make sure it's close by staff. So some things like you got to take a. The other thing is, if you miss it, but I recommend that you look at as well as some of the, like if you have wall mounted PPE units, that you take a look at that and see if any of them have been damaged. You should try to pick up that during the construction process, but some of the damage may not be observed until after you've moved in. So then you're still gonna find that damage and get those repaired. I already talked about the storage and the clean and dirty utility rooms, but your clean supplies are going to be that clean utility room. You're going to need to take a look at that, see if you need to order any additional shelving, because I mentioned that previous episode you can have a lot of people using that room to store a number of different products. So you need to make sure to see if you need to order any additional shelving, and then speak with your administrator or senior staff or executive director to order additional. So you got to get your place. You're going to find things, even though you try to get it organized before you moved in, you're going to see that some things are not going to work out the way you thought it was going to work out. And then you're going to need to tweak things a little bit to make it work with your needs and with the staffing workflow. So you're going to need to be very vigilant and go around and check and see what things you need to kind of change. And there'll definitely be some things that you need to change. So that's why you need to spend the time and put effort into find those issues that you come across. So the other thing something else for the PPE is you may need to order additional wall-mounted PPE units for your supplies if you decide to go in that direction. And you might need to want that, as many of those being close to the point of care of a patient or resident rooms, for example, and you need to see if there's some additional ones that need to be ordered. And I would mention that you're going to check to see if there's any that's been damaged. And if you decide to go with like a mix of wall-mounted and portable units, that you're going to take the portable ones, store those in the clean utility rooms, and then move them to the resident or the patient rooms. The downside of that, it requires a fair bit of space to store those. Also, sometimes the products that are ordered are low quality and really don't last very long before they start breaking down. And I've seen that occur within just months, where the wheels are falling off because it's connected to a piece of plastic, and so it doesn't stay on for very long. So, but you do want PPE portable ones to be on cards so that you can easily go back to the clean utility rooms once you've disinfected it and taken it back to those rooms, to the clean utility room. So you're gonna take a look at a number of different things that are gonna kind of come up. even though you've gone through it many times, there's still things you're gonna miss. You may see that one of the like a few hand sanitizer dispensers, like I mentioned earlier, they got missed, and you might see some of those in the resident or patient rooms that got missed. So you want me to take a look at all that. Well, you will also find like your storage rooms, like your main storage room, might not end up being big enough for what you were attending. You might it can look quite large until you start putting in the shelving units, which I do recommend that they're on wheels so you can move around. You might find that you don't have as much storage space as you can. That's going to be difficult to change once you're into the building. So what you'll have to do is you end up ordering your supplies every couple of weeks to keep up on everything you need for the staff or for the PPE. So you're going to take a look at that. Like I said, you're not going to be able to increase the size of that space. So this is why it is so important that when I focus on that part one of the series, to spend so much time on the design part of it, because you want to get the building design the way you need it to work with adequate spaces and sizes long before the building gets built, and especially long before you actually move into the occupancy and you start using the new building becomes operational or the new section expansion. Some things like are difficult to change, like I mentioned in design. If regulations are changing all the time, so you may need to make some adjustments. But now usually there's some portable additional sinks being installed in healthcare for hand washing. So that's a common requirement now. So hopefully they've been installed where they need to be, and you don't need to install anymore. Otherwise, that'll be a fairly big or not a small change, and then you'll have to do another infection control risk assessment for that project if you had to add additional sink or sinks in the facility. So don't forget about the entrance going into your building, to make sure that as well as your exit, that you have easy access to the masks and sanitizer as you're coming in, and that it's easily visible, and that you've got a good location for it. Because what happens if you don't, it ends up getting bypassed and people just walk by. So you need to have a good present location for it, so that it doesn't get missed when you're coming in, and you see it quite quickly before someone walks too far into the healthcare setting. So you want to find a good location for that. And same as when someone exits. Ideally, if you can, it's good to have the hand sanitizer dispenser close to the exit of the new building, so that people can do their hand hygiene before they exit the building. One of the things, there's going to be a lot of things in terms of, like, when you talk about the additional staffing. So you're going to, within those first 6 months, there's going to be a lot of changes with the staffing. You're going to continue to do your staff education for all the IPAC measures, which includes outbreak management, for hand hygiene, masking, wearing the PPE. You're going to be doing a fair bit of that, because what's going to occur is you're going to probably need additional staffing in certain departments. And you also, in the first 6 months, you could see a fair degree of bit of staff turnover as well. Um, and you're going to be helping staff get familiar with the building in many different ways, but including it for infection prevention and control, getting them used to where all the supplies are located and where they make sure they got easy access and there's no barriers that's preventing them from accessing and getting quick access to the PPE that they need at any time, especially after hours and on the weekend. So we don't want to be an issue with not getting access to the PPE supplies. Another area that I would have focused on would be the staff lunchroom. So this one's a little tricky, but often we can see it's a larger staff room located in the basement. For example, I'm going to use this for a new building. That's one way of doing it. It's probably pretty common. So you're going to want to make sure that you got a lot of signage up down there for PPE, signage as well as extra supplies down there. So you want to have a station set up for supplies down there. One of the problems of having that general staffing lounge, typically will be in the basement, is that it brings all the staff to the one spot, which might be great. But when you go in an outbreak, that becomes an issue because you do not want people leaving the outbreak floor or wing and going down to that general area, because that would be a great way to spread an outbreak throughout your facility if you have staff mixing those from an outbreak floor, going down and meeting that staff from the other floors, and you get that cross mingling with, and then you're increasing your chances that you're going to spread that outbreak to other floors. So ideally, it would be good to have like a small staff lounge area on each floor so that people have a place to go after lunch, even if they have to alter their lunch times and do it at a little bit different time. If you end up not having that, then what you're going to have to do is, which is harder, is that larger staff lunchroom that you have in the basement. You're going to have to find dedicated space times when the outbreak floor staff can use it, and that's much harder to coordinate. And then you got to make sure you're wiping down the tables and doing some disinfecting between when they're using it, staff from the outbreak floor, and when the rest of the staff are using it. So, because you don't want the outbreak to spread throughout your facility. So these are some of the things that, it would be good to talk about at the design stage, rather than trying to deal with it afterwards. Because if you don't have it designed in there, it can be very difficult to find a space for staff to have lunch on the outbreak floor. So see some of the things that you're going to kind of look at. The other thing is you're going to want to do a fair bit of auditing throughout the facility. So the first 6 months is when you want to do. You may have done a lot of training initially for a lot of new staff, but you're going to have to continue that and do a fair bit of extra training and validating that if that training is really worked and it's being applied. So you're going to want to do get some help and do a fair number of hygiene, PPE, and masking audits to see if people are following the IPAC measures the way they should be. So you want to make sure that you're increasing your auditing process. Even though we know the downsides of like direct observation, people change their behavior, but you gotta be doing the audits, unless you have some kind of more sophisticated electronic system or something. So you need to be doing audits. And the other thing I don't want to forget about is in those first 6 months, you also want to be doing connecting with the staff a fair bit and asking them questions about things that wasn't working and not working in terms of for infection prevention and control, because they're going to be using the space, and you got to find out what things might have got missed in terms of the workflow, including the location of the hand hygiene and sanitizer dispensers. So they're going to be a good source of information to determine whether there's some additional ones that need to be installed, whether you need to move some of those, and anything else. Like, is there any issues with the portable PPE bins if you're using those, or any problems with the doffing bins as well? You want to kind of get all those issues and get them written down, put in a file or Excel table, and start working on those. So you're going to have many issues to work through, and that's why you want to be keeping track of them and start working way at that list and working on the ones that are the highest priority from infection prevention and control perspective. So just some of the things is for infection prevention control is make sure that you kind of when you're doing those walkarounds through the facility, that you're looking to see if anything. One example could be the staff are propping any of the doors open with like boxes or anything like that. You got to be watching for that, because those areas within the home that should be only accessible to just the healthcare staff and not to residents. So you're going to want to make sure you identify any of those potential issues, that nobody is kind of doing something like that, because that would be a risk to the safety of the residents. Some of the other things that could kind of come up is, just make sure that you get your signage figured out and have a good place where that's all going to be located. That could be in a smaller PPE rooms. It could be by the nursing station area. It could be by the comm area where all the computers are. You got to make sure that's easy access, and that there is an easy way to put it on. So, my experience, some things we did was actually putting those up using command hooks or something like that. That makes it really easy and fast for you to do that and take it off. The worst thing you can do is actually put up signage with tape, because once you've applied that tape and you try to get off, it doesn't come off. Or if you try to take it out, it's going to take you a long time to get it off, and you still won't get it all off. And then it becomes an issue for IPAC, because you can't disinfect it after it's been used, and you can't wipe it down. So you want to make sure that you got the process figured out, how you're going to put those signs up. Like I said, one solution is to use the command hooks, but then you also need a place to put and store all those signage somewhere. So you got to figure out where you're going to put all your extra signage for, contact droplet precautions. The same as the signage for, for masking and everything that you're going to be putting up throughout your home and stuff. So you got to figure out where you're going to put all those extra ones, including the outbreak signage as well. You got to, make sure that you got that covered as well, and you got enough signs available to be used when you go on an outbreak. And outbreaks can, like I said, quickly go from one floor to another, so you got to make sure you got a good extra supply so that you can put them if you needed to in multiple areas of the home or multiple floors. So you can quickly see how things, you could end up using a fair number of signs very quickly. So we'll move on to the next segment. So a few more things to get in talked about for this episode is the transition between construction controls and normal operations. So there's a few things just to kind of wrap up this part 4 that I want to talk about. Often you can assume, there's an assumption made that once the construction is complete, that all the risks is gone. That's couldn't be further from the truth. Once that construction is done, and you do get occupancy, and whether residents or patients moving in, it's still going to be a number of things that are going to be done. And these include, could be a fairly long list of deficiencies. So these are the smaller things that are going to come up that need to be finished by the contractor, and just, a number of sub-trades. So that list, that you're going to create a list of things that need to get completed. And some of those are definitely going to be IPAC related as well. So the list, but one of the reason I want to bring it up is because it actually will bring in some additional people into the healthcare setting. So you're going to want to make sure that they're following any IPAC protocols when they're coming in, and that they're actually taking into consideration the risk to, could be safety risk to residents and patients. So as they come in and do those deficiencies of those small fixes within the healthcare setting. So, and that could include anything, including repairs to any of the millwork, countertops, any of the flooring. There could be tears in the laminate or vinyl flooring that needs to be repaired. So you got to make sure that from a number of different reasons, perspectives, that the work's getting done, and it gets getting done in a safe manner, and there's no issues in terms of for infection prevention and control, no problems as well. But it is additional people coming in into this healthcare setting, so you want to be vigilant of that. If there's anything you need to talk to the general contractor about, you need to bring it to their attention before anybody's coming into the healthcare setting. So, wanted to talk about the environmental cleaning because there's going to be a fair bit of that, a lot of that, as you prepare to get ready for patients or residents, is getting the environment clean. So the contractor will do so much, but that usually is a lighter cleaning, and you're going to have to do housekeeping staff have to do a lot more, because in a large healthcare setting, especially if it was a new building, there's going to be a lot of cleaning and repeated cleaning that's going to be occurring right up until you have occupancy, and then even afterwards. So imagine when they're moving in, using long-term care as an example, that's a lot of people coming inside the long-term care home, moving the things in, and that's again, they're going to create a lot of dust and everything. So you're going to be doing a lot of disinfecting and wiping everything down as well. So expect a lot of cleaning of surfaces within those first few weeks, and then it'll start tapering out and getting into a normal operation where you're not doing as frequently as within those first few weeks. So be prepared to have extra staff to do that cleaning that's going to be needed. So the same thing as some of the thing is, you will find that, some of those areas, some areas that might have got missed in terms of environmental cleaning. Now is the time where you actually gotta make sure that you find those areas and do the environmental cleaning and get that fixed up. If it got missed during those first before occupancy. So in terms of the commissioning and the HVAC system, with the it's best for all that testing to occur, but I have seen it where some things were not done, because of the time of year. For example, the air conditioning system will be checked or wasn't checked like during the winter when, say, that's when you got occupancy. So sometimes certain components may not be tested until several months after you've got occupancy. So you're gonna be checking on, the balancing of the system, and checking to see how the different zones are in healthcare doing those testing of the rooms in terms of temperature readings, to see if it's within a comfortable range for patients and for residents. So that's something you kind of got to be quite vigilant on. Is just checking that, because you will find that there are going to be some problems within the system. Everything's not going to work perfectly. Very unlikely it will. So you need to find, testing it out, finding those areas that are not working as well. And I mentioned earlier about in terms of within a acute care hospital setting, checking the positive pressure and the negative pressure areas, for isolation rooms, and see for OR to make sure it's functioning properly and you're getting the correct number of air exchanges occurring per hour. But yeah, there will be a fair bit of testing and troubleshooting and some issues with the HVAC system, even after you've been into the healthcare setting for a number of weeks, even months. So it's going to be, everything is not going to work perfectly, as well as, depending when you move in, you're going to probably see some water damage or water getting into certain areas. I've experienced with that, where you see, once the snow starts to melt and you start to see some of that water coming into the healthcare setting, and it does impact IPAC, because obviously some areas and the drywall could get damaged, and you could have growth of mold in those areas, so become wet. So it does involve IPAC, and you need to be vigilant and watching those areas to see if you have any problems with water coming in. So as well as another one that could occur is within the water system. So when that's being would make it see happen, and we've seen it happen, is where some of the toilets may not work properly, and you could have overflow from that. And many strange things can happen with equipment being left behind by the trades, and even though the plumbing may appear to be fine, sometimes things get dropped down in the plumbing, and then suddenly you have everything backing up because of it. And depending where things get clogged, sometimes strange things get left in the plumbing when they're doing it, or drop down, say when they were installing the toilets and stuff, and then you end up with a clog, because there's a piece of equipment stuck in there, and that's going to cause things to back up and could end up overflowing onto several resident or resident or patient rooms. So that's why I said that you expect many different issues in those first few months or in weeks. Anything that's the system, things get tested, and they're not all those issues are not gonna be found in the first few days or first few weeks, or usually by weeks, but not in the first few days. One of the other topics I wanted to talk about was the surveillance and early signal detection. So you want to be very vigilant within those first month and maybe up to 90 days, because especially in a new healthcare setting could be difficult. It's also a new building. You need to get kind of used to what are going to be your kind of monthly numbers when it comes to infections. So it's going to take you some time to start figuring that out especially for a new healthcare setting. So what is the normal that you're going to see there? So you won't have that. You'll have some information from your previous building, but you won't have, what's it going to look like. So certainly emphasize that until you get an idea of what things are going to be like in the new building, that you increase your surveillance for the first few months, especially with the first few weeks. But for going down to like 3 months, because you're gonna, like I mentioned, I think I mentioned earlier, you're gonna have a lot of people coming into the building, even when you get that post after occupancy, and that can increase the risk of spread of infections as well as the start of an outbreak. So you want to make sure that you're doing everything possible. And the other thing that could happen is some of the infections that are happening may not get reported by the care team and the nursing team. So you want to make sure that they're recording all of the infections so that you don't miss any of those infections, and because that would throw off your monthly infection rates for various infectious diseases. So you want to make sure that you got the surveillance and that the appropriate infections are being captured. Be very careful of the communication. Breakdowns occurring after you get occupancy, so make sure that IPAC's not being excluded from those key meetings that are going to be occurring post-occupancy. Because it doesn't end once you get occupancy, you're still going to be very much involved once you move into the building. So make sure that you continue to have good communication within the leadership team and with the construction team who are coming in, as I mentioned earlier, to do the deficiency. So that another one I want to kind of go quickly is the education and re-education of staff. Even though you've done education with staff prior to moving into the building, so you would have done training. There's going to be still a lot of retraining, getting retraining for infection prevention control afterwards, and because you're going to be doing that repeatedly until, especially new staff, and even some of the could be staff from a previous building coming over. Make sure that they are following all IPAC protocols. So it's going to be a lot of training that you're going to be doing, and with the staff. So you can't think about it as that you've done the orientation and now you're done and that's it. That's not going to be the case. You're going to have to do a lot of retraining, education with the staff to make sure all those IPAC measures are being implemented the correct way, that they're doing the hand sanitizer, wearing the mask correctly, doing their doffing correctly. So there's a lot of education. And I mentioned, I think maybe in previous parts of this series, you got to make sure that you got a process to record all that training, because it's going to be part of the process with like, for example, Ministry of Long-Term Care, or it could be Ministry of Labor. show proof and documentation that you've done all that training. So you got to be very vigilant in tracking all that education that you're doing with staff, and it's got to typically for regulations, it's got to be a mix. It can't be all online training. So there's going to be expectation that some of that is actually occurring face to face with infection control staff and with like say a small group of staff. So or a larger group, but the downside of the larger group is that it's a little harder to see how everybody is, for example, donning and doffing. So there's pros and cons there with in terms of the group getting too big. But you can have you could have, especially for a new bill, you could have some temporary staff coming in from an agency. So you got to make sure that they're following your protocols for infection prevention control, and that the protocols that they may understand from another healthcare setting, because your policies could be very different or different. I don't know if you have to be very different, but you got to be careful that make sure that they're aware of the way that you do it within your healthcare setting, because you don't want them doing totally something different, and then other staff observing them and they start repeating what that person's doing, that temporary staff member, and that's not in line with the process that the protocols that you have set up within your organization. So you want to make sure that they're following the organization's protocols. So there's an education, you want to be reinforcing that. And then I think the other thing that's, I think I mentioned earlier, you got to be making sure that you got your home specific outbreak plan created for that setting. You can modify one from another setting to speed it up for you, but you got to make sure you modify it with appropriate information for that new site, or if it's a major expansion, for example, that you've updated it to take in consideration that that extension to the healthcare setting, whether that's an extension to a long-term care or acute care. So you got to make sure that you're making those adjustments to those outbreak plans. So there's some other things to take into consideration. Is make sure that you do kind of like a formal post-occupancy IPAC review. So to take a look at your program and make sure that everything is functioning the way that you would like it to function. So you want to be doing those kind of post-occupancy risk assessments like every maybe like at 2 weeks, and then at 30 days, or maybe monthly, few times, and see if you need to be making any changes to your infection prevention and control plan or your program to see if you need anything that would need to be altered. So be careful with that. And be prepared, hopefully it doesn't occur, but it can occur within a new build. A new setting makes you very vigilant, as I mentioned earlier, with surveillance, because you could end up with outbreaks. So, and make sure you got a good supplies, because you want to make sure you get adequate supplies to manage an outbreak, and because of the risks that come with moving into a new building, a lot of people coming into the building. There could be risks associated with all the people coming in. That varies by time of the year, but you want to make sure that you get the supplies and you're ready for a potential outbreak if it does occur. So, and thing for I mentioned about the surveillance, be very careful about tracking your information about your surveillance. And I want to kind of just wrap up the section by saying, make sure that you're, the first month or two, that you're connecting with the staff on a regular basis to see what issues they see within the home, because you want to pay very attention, because they're working the floor every day. They're going to identify where some of the gaps are and some of the things that need to change. So be very, you need to be present on the floor and talking to the staff, and find out where some of those problem areas are occurring, so that for infection prevention and control perspective, you can be working on them as they come up and as you're talking to the staff. So very important, because if you don't do that, then they're going to stop. They won't talk to you about IPAC issues. So you got to make sure that you're very much present on the floors and connecting with various departments, the staff, and finding out what those issues are. And as I mentioned earlier, I think in this episode, create a running list and start working on the highest priority items, so you can address those. So let's wrap up this episode. Thank you very much for joining. My name is Wayne Tucker. I'm the host and the founder for the Infection Control Exchange podcast and the broader ecosystem. Please take some time to share the episode within your social network, including doing a repost within LinkedIn. And I think remember, there's four parts to this series for construction and IPAC. So hopefully you get a chance to listen to and view the other episodes for within the series. So there's four parts for the construction and infection prevention and control. And thank you very much.